for you to build your skills of clinical reasoning. So clinical practice section is very, very relevant for medical students. So the New England Journal of Medicine guys also take care about the visual images. Yes, for example, they have two very interesting topics: images in clinical medicine. So you just look at the images, you can save them, you can just try to memorize them. Well, usually they are very, very relevant, and they are recognizable. And image challenge, when you have just to guess what kind of diagnosis is this, and you get immediate answer after this image challenge. So this is just a quiz for you, just a training, a short training. So New England Journal of Medicine can be accessed free of charge here in Russia. Yes, and that's why you can use it fully. Yes, you can use archives from this journal beginning from the 1995, as far as I remember. So it is very interesting, but of course you shouldn't read every article in it, because there are original research articles which are not very interesting, not very relevant for the medical student. British Medical Journal, also very, very interesting, very important journal, which is read by every doctor in United States, every doctor in Great Britain. In this journal is not free, but several sections are free. In this journal, most interesting are the education sections. Education, yes, you see, education. So in the education section, very interesting are endgames. So in every issue, and it is published every week, they have anatomy quiz, they have case report, they have some examination quizzes about the investigations, and they are mostly free, so you can access them free of charge. British Medical Journal is available. Free British Medical Journal is available after several years, maybe after 5 years or after 10 years after publishing. Well, it is available. So it's also very interesting to see through the, to look through the archives of the journal. British Medical Journal has a special application for students, student BMJ, and I would like to draw your attention to this, because they publish clinical reviews free of charge, clinical reviews from BMJ free of charge, and they publish many students' reviews and original research. And maybe in the future we can do a research and maybe we can publish it in student BMJ. Who knows? Yes, who knows? They have several interesting sections, and student BMJ is a monthly journal, and you can read it free of charge on the student BMJ site. They have education section, they have news section, they have reviews, and well, it is very interesting, very relevant student BMJ, very relevant source of information. Medscape, yes, you should all register on Medscape if you haven't registered yet. Yes, the registration is free. And Medscape gives you not only the news that are, well, yes, interesting, but not most important for you, but what is most important is a reference which can be used for writing reports, for getting the necessary in-depth information about a disease, because every article is very thorough, is very up-to-date, has various numerous images, and is really relevant. So you can get information on drugs from the Medscape. You can get information on diseases and conditions. And what is interesting, when they talk about treatment, you can immediately get the doses, the side effects, the interactions of the mentioned drugs. So this is very, very good for you because you don't have to look elsewhere for this. So Medscape is a recommended reading. And they have also CME section, very important, very interesting CME section on Medscape, yes. This CME section features various articles written in, well, not simplified, but written in a very clear language without any inappropriate details. Very appropriate, very on topic, so you can also use it for additional, for getting additional information. CME modules from Medscape. Up to Date is considered the Bible of electronic internal medicine. Yes, Up to Date is a resource which is made by several hundreds of reviewers, of authors. Yes, unfortunately, it's not a free resource, but they have lots of information on various topics. And what is most important, most of all the United States hospitals, and maybe many Malaysian hospitals, I think, are subscribed to Up to Date, so you can get the information while being on campus, not while being at home, yes, but while being on campus. In American hospitals, in American universities, it's very simple. They just come to one of the laptops and they just enter the necessary term and they get the list. For example, to the term anemia, you get the list of articles which discuss in great details every aspect of anemia, for example, or any other disease. This is absolutely fascinating, and well, this research is worth trying. Yes. Maybe if we can get some trial access, I will show you how to use it, and we can maybe save some information from it. There are some ways of getting trial access to the Up to Date. Yes, there are at least well, there are Chinese hackers. Yes, they can hack anything. Yes. Okay. And I would like to draw your attention to not very difficult reading. Yes, reading, tea time reading or coffee time reading. Lisa Sanders is a consultant for HouseMD. Yes, she's a consultant for HouseMD, a medical consultant. She's a medical doctor, and she has a column in New York Times newspaper. She has a column every month, as far as I remember. She gives a special article telling about a patient in simple terms, just for lay people. Yes, but it doesn't mean that you don't need to read this, because it's very interesting, it's very vivid. Yes, Lisa Sanders, very interesting collection of cases, and as far as I remember, so far it's free. Lisa Sanders also wrote a book, Every Patient Tells a Story, a very inspiring book, a very deep book with information about the with bedside stories. We witnessed the process of solving diagnostic dilemmas, diagnostic problems. And she tells about the dramatic cases, about the dramatic diagnostic cases. She discusses how the doctors deal with the difficult patients, with the difficult problems. So, very good book. Also, if you have free time, some free time, maybe in summer, you can get yourselves Sherwin Nuland's books, yes, especially the one that is a bestseller, which is called How We Die. Yes. Well, it's a fascinating book. Yes. I read it, and it's really fascinating because Sherwin Nuland, he's a medical doctor, and he explains in a very detailed way how the process of dying takes place. well, the questions, the issues of living and dying are always most important ones. And for the reflections on life, final chapter, you can read How We Die book, because we can get a very vivid description of all the processes, of all the feelings of a dying person, told by a dying person, yes, because he made a research, he talked to dying people, he talked to physicians who were in contact with dying people, yes. This was very, very interesting, and the book is vividly written, very, very good book. Nuland is an author of How We Live, The Soul of Medicine, and other interesting books. He was a surgeon, he is a surgeon, yes, he's a surgeon, he's a retired surgeon, yes, and Lisa Sanders is an internal medicine specialist, as far as I remember. Also, to get some lectures, some talks on very, very, well, on the edge innovations and research in medicine, reliable and first-hand source of innovation information. You can go to tedmed.com. You can see many talks about very important topics in modern molecular biology, in cancer treatment, and so on and so on. So it's very good for expanding your mind on most up-to-date information. Of course, these are hypotheses. This is not the clinical teaching, but just to expand the limits of your mind. It would be very good to look some of the presentations. Yes, they are also free. And as a final, I'm sorry for the delay with the end of the lecture. Yes, as a final part of the lecture, I would like just to tell you about the activities in the framework of Russian Student Scientific Society. I've been the deputy head of our department's SSS for 3 years. Yes, and for these 3 years we took part in 3 Olympics, so-called Olympics. Yes, we have every December we have Russian language Olympics. Among, well, this is a kind of contest between 10 or 11 internal medicine departments. And last December we took first place. We were the champions. And we took second place and third place 2 years before. So I think that it was really, really great. It was a very good experience, and well, maybe I think that the spirit of competence is very good for us too. And well, we can also make some competence inside our student scientific society. So what do we do? What do we do? Of course, the most important is developing, well, we set small goals, just small goals. Of course, most important is, well, to become good doctors, to get a publication in British Medical Journal, for example. Yes, but these goals are too high for us. Yes, first of all, you begin with the small goals. So first and most important is developing oral skills, developing reporting skills. Yes, and for this we make review reports on every area of medicine which is interesting. Every area. Well, you are fascinated by some problem, yes? For example, you want to be a dermatologist, yes? But you would like to tell about systemic manifestations of systemic diseases on the skin, on the patient's skin, yes? Is it relevant for internal medicine? Yes, of course, yes, because sometimes by systemic manifestations, by skin manifestation, we can diagnose the disease, yes? For example, migrating thrombophlebitis, yes? We can diagnose pancreatic cancer, yes? We can suspect pancreatic cancer, yes? Because it's a perineoplastic process, yes? Very important. So you see some distant manifestations and you can diagnose an exact disease. Well, it's fascinating. It's a surprise. Review reports. latest medical news, yes, the information about some breakthrough investigations, yes, and we also can do this investigation. We can also do this kind of reports because, yes, you know English. Unfortunately, even the best Russian students, they don't know English well enough. Unfortunately, yes, but you know English. It will be easy for you to make some digest of latest medical news. Case presentations. We can take cases from New England Journal of Medicine, for example, just abridge them, yes, and to make a presentation of this case. Then we may find some patients for us, yes, and of course for this we will have to make some venue, yes, some place for us to perform maybe encounters with patients and so on and so on. So case presentations, we can just take a patient, maybe already deceased patient, autopsy case, yes, and to discuss this. This is not difficult, yes, and ideally we can just talk to the living patient, yes, discuss this. Then interesting internet sites and books overviews is also very important, so we can recommend some interesting books that we have encountered. Then we can meet specialists in various areas. For example, we had a very interesting meeting with cardiac surgeon who implants ICDs, yes, and he demonstrated a very interesting movie on the ICD implantation. It was very interesting. He was from Piragovka, from the SMSA, the Scientific Surgery Center. Then we are visiting other scientific society meetings. For example, psychiatry department, very interesting information on psychosomatic medicine. Yes, we had a very interesting encounter. But unfortunately, these last two things are so far not very possible. Yes, because of due to the language barrier. Yes, it will be difficult for these specialists. Unfortunately, they are very good specialists in their fields, but they do not talk English, and only they can just say hello and goodbye. Unfortunately, yes, unfortunately. There is no correlation between the brilliance of a specialist and the knowledge of English here in Russia, unfortunately. Yes, but well, it's up to us to take up all these four activities, types of activity. Yes, and we can do it much more as well. Yes, we can do some research. Yes, but of course this is the future things. Yes. For the first time, I would like to urge you to focus on case presentations, on reviews, on medical news, just on communication, on interchange, yes, and we can gradually grow into something more important, something more different, something important, something more imposing, I would call it. Well, and as a final touch, how to stay enthusiastic when things look dark. Osler told for the students, yes, of course, it's very difficult. Sometimes we feel depressed. We feel that our attempts at being good students, at being good doctors, even, well, they're futile. So if you think if you're depressed, just remember that nothing will sustain you more potently than the power to recognize in your humdrum routine, as perhaps it may be thought, the true poetry of life, the poetry of commonplace, of ordinary men, of the plain, toil-worn women with their loves and their joys, their sorrows and their griefs. Patients are like us. Yes, we are special because we are doctors. Yes, we have a special mission in our life. Yes, we have chosen this mission. We have chosen this way of life. Yes, it means that there is large responsibility on us. Yes, big responsibility. But we are like them. We also have our joys and sorrows. And to feel these joys and sorrows, to take part in their lives, well, this is the most sustainable thing, the most sustaining thing, the most promising thing, the most rewarding thing maybe for us all. And as an aphorism before parting, yes, a physician is someone who knows everything and does nothing. A surgeon is someone who does everything and knows nothing. A psychiatrist is someone who knows nothing and does nothing. A pathologist is someone who knows everything and does everything, but too late. Yes, it's too late. So yes. Yes, it's just a wise saying, it's a funny saying, but well, there is a grain of truth in it. Yes, so please try to be someone who knows everything and does everything, and on time. It's very difficult, but it's possible, yes. A student, a Malaysian first medical university student is the fifth kind who knows everything, does everything, and is on time. That is strive for me. Thank you very much. So you're welcome. Your feedback is very welcome. You can drop me a line at pisser@gmail.com or contact me on Facebook, or you can visit my site for English medium medical students, drpisser.com. And we are planning with the dean, we are planning to improve this page and to improve it to fill it with more material, with more teaching material, because well by now it's just some additional material information site. Well, it may be interesting. So thank you, terima kasih. If you have any questions, just feel free to ask them if you are not exhausted. And I'm sorry for not keeping to the time. Too much to tell you first time. It's too much. I wanted too much to tell you many things. So any questions? You can always contact me and ask me the questions in private manner. Okay. So I think that we'll discuss with your senior students, with your officials, senior student officials, yes, with your guidance. The next place for our meeting, the agenda of our meeting will discuss the official status of our Student Scientific Society, yes, if you are interested, of course, yes, so if there is enough will to continue our meetings, and I think that we will inform you on Facebook, and I think that we'll meet once more, maybe before the end of this semester or in the very beginning of the next semester. I hope this will be possible. Yes. So thank you very much. It was really great to see your bright eyes, to see your soul. Yes, it's great. Thank you.
Well, I believe that the talk was very enlightening. Don't you think so? Well, the first part about ethics, I think that was very important. For the higher courses, we have it already, but bear in mind, it was in Russian. For those of you, the 3rd, 4th and 5th course, take this as an advanced tuition, and it's free. So you better check back on Dr. Pisara's lectures, which we will upload it later, if you don't mind, sir.
Yes, yes.
No problem with that. So you can download it later through our website. Okay. And the second part was very relevant about journals and information, where we can best find information. You know, there's just too many information on the internet, and we go, woo, there's so many things. So thank you, sir, for giving us a guideline on how to do that. So before we part, I would like to invite our president, Suzwan Hafizan, to present Dr. Pisara with a little token of our appreciation from us for his ongoing commitment, his enthusiasm that has inspired us so much despite the past. Thank you so much. So thank you. A big round of applause, people. Well, I guess that marks the end of our session. Thank you all for showing up. It was a great pleasure having you guys here. Thank you for your support. Your support is our motivation. But please, I ask for you to be seated. My colleague will brief you about the membership and the status of our Student Scientific Society. And we would like to invite the VIPs out first. Okay? So thank you guys. Thank you.
Assalamualaikum and very good evening, friends, or should I say for the final year students, the soon-to-be doctors. I hope everybody enjoys today's session. Today I just want to brief a bit about the Student Scientific Society. This is our chart flow. Student Scientific Society is under the SMSA. It is under the in charge of Academic Bureau. So whoever taking in charge of Academic Bureau will be the admin of the Student Scientific Society, and Dr. Mihai Pisarev will be our supervisor, hopefully. What I'd like to brief is about the registration. If you guys want to be a member, there's certain things that you guys have to know, because actually this thing the members need to be committed to this society, as in we don't want to have a sleepy members, the one who only present and listen to the lecture. If you are a member, you have to be to participate, doing case presentation, because the aim of this society is actually to build your public speaking skills, to develop all these skills, and for you guys to be a better doctors in the future, hopefully. So right now I would give this forms where you have to fill up your name, your year and your groups, and then phone number and emails for us to find you guys on Facebook, because after this we want to make Facebook groups for SSS, so that there we can discuss when is the next meeting and what topics we would like to discuss. And I think that's all. So you guys can come in front and register if you guys want to be a member.